You're spending thousands on your face, but take a step back. Your chest, elbows, knees, and abs are telling a very different story. We've been trained to wage war on facial aging while ignoring the other 90% of our skin, the parts that can actually give away your age faster. Most people don't realize this, but your body can actually age faster than your face. Body skin is thinner, drier, and can lose collagen just as quickly, if not more, depending on your lifestyle. But unfortunately, most people do nothing about it until it's too late. Staying youthful and maximizing your attraction doesn't stop at your jawline. It's a head-to-toe strategy. A lot of people don't know that biostimulators and regenerative injectables can be used in places other than the face, and the body is one of my favorite areas to treat with Sculptra because it can help tighten the skin and improve the skin quality, target cellulite, lines and wrinkles, and aged skin. I'm breaking down how to anti-age your body from sun protection to why lifting weights might be the best skin tightening treatment and fountain of youth for your body and health. And because I know you love receipts, I have real unretouched before and after photos of patients that I've personally treated so you can see the difference for yourself. If you're new here, my name is Emily Dowe. I'm a board-certified PA that specializes in aesthetics with a focus on regenerative injectables, wellness, and longevity. We talked before about how people who are very lean and fit often tend to look older in the face than those who carry a little extra weight or are overweight because facial fat and fullness can soften the signs of aging. But there's the flip side. When it comes to the body, lean, muscular people tend to age better to their body. Their skin looks tighter and their bodies generally look younger. That old saying, you have to choose between your fanny or your face, used to feel true, but it's not anymore. Thanks to a select few injectable treatments, you don't have to choose. You can be fit, lean, and still have volume and support where your face needs it most. And that hits home for me because I live the lifestyle. I train hard and I'm lean, but I know firsthand how hard it is to keep facial volume when you're in peak metabolic shape. The good news is that with the right strategy, prevention, muscle tone, and biostimulators or regenerative injectables started early enough, you can have both. Here's something most people don't realize. Aging doesn't show up the same way everywhere. The skin on your face and the skin on your body are not created equal, and they can age on completely different timelines, especially depending on your lifestyle. Remember that we discussed in this video that the face and the body are derived from two different types of tissue. During embryonic development, when we're forming in the womb, the face and neck are primarily derived from neural crest cells, which are highly specialized stem cells. By contrast, most of the body develops from mesoderm, another stem cell-rich layer. Neural crest-derived facial skin often has different collagen architecture and regenerative capacity compared to mesoderm-derived body skin. So facial skin doesn't just look different, it acts different. Facial skin has a richer blood supply, and more oxygenated blood means the face gets nutrients faster, heals quicker, which means it has a stronger regenerative potential. Body skin, on the other hand, comes from mesoderm, and while it's often thicker, it doesn't have the same vascular density. Less blood flow means body skin is less metabolically active than facial skin. The skin cells don't divide as quickly, and that slower metabolism means slower repair. It directly affects how fast your skin can renew itself. Facial skin typically renews every 28 to 40 days, depending on your age and the overall health of your skin. But body skin, like your arms, legs, chest, and back, can take up to 60 days to complete a full turnover cycle. That means dead skin cells linger longer and repair happens more slowly. Ever notice that when you get a suntan, or God forbid, a sunburn, it sticks around longer to your body compared to your face? This is why. Also, the skin on your body doesn't have as many oil glands. Your face, especially the T-zone, is packed with sebaceous glands that produce sebum, which act as a natural moisturizer and barrier. But body skin isn't as rich in oil glands, so the skin to this area can look drier and be more prone to a crepey texture as you age. Here are the top body zones that can show your age: the chest or décolleté, abdomen, elbows, knees, upper inner arms, and the butt. One thing most people don't realize is that body skin doesn't bounce back like facial skin does, especially after things like weight loss or pregnancy. Body skin is under more mechanical stress, and it simply doesn't have the same structural support or metabolic activity as facial skin. So once a certain amount of collagen is lost from aging in areas like your knees or arms or abs, it's nearly impossible to reverse without surgery. This is why prevention is everything. And one of the most important ways to prevent skin laxity, crepiness, and that deflated texture that makes skin look older is to avoid excessive sun exposure beyond what your skin is genetically designed to handle. Sun damage is the most aggressive skin aging force you're facing. Nothing ages your skin faster than the sun. Not time, nor genetics. Lean, muscular people tend to age better to their body, but the other side of this is that people who are very fit can sometimes get a lot of sun exposure. Here in LA, the city is known for health and fitness, and a lot of people go hiking, run outside, play volleyball, surf. But unfortunately, if you're someone who is a lighter skin type, you cannot afford to go out in the sun and expose yourself to UV radiation beyond what your skin is genetically designed to handle. UVA rays penetrate deep into the dermis where your collagen and elastin live, and over time, UV exposure breaks those fibers down, triggering enzymes that literally eat away at your collagen. One area that takes a major hit from sun exposure, in particular in women of European ancestry, is the décolleté, the delicate skin to the upper chest just below the neck. I've met women who were in their 20s who had the décolleté of someone who was 35 or even someone in their 40s because the skin to their upper chest got so much cumulative sun damage over the years from living in a warm climate. People of European ancestry who live in high UV index regions closer to the equator, in particular those of Northern and Central European ancestry who can have skin that's more prone to burning, you have to be very careful with how much sun exposure you get, regardless of whether or not you wear sunscreen. I want to give you a very important word of advice here because I worked in dermatology as a PA for years, and I came to the realization that sunscreen gives people a false sense of security because people think that if they just put on sunscreen, they can get as much sun as they want, as though sunscreen is some sort of 100% shield. Sunscreen reduces the amount of UV radiation that reaches the skin, but it doesn't block it entirely. It just gives you slight additional protection. If your skin is getting burned or tanned, that is your body's response or your skin's response to UV damage. When your skin senses UV damage, melanocytes produce pigment called melanin. That pigment gets pushed towards the surface of your skin where it forms a protective shield over your cells to try to prevent further damage. So you can't get a tan without some level of damage already happening because tanning is our skin's defense mechanism. So anyone who cares about preventing the skin on their body from aging, you really have to watch your sun exposure. Unless you're somebody who has a medium to dark brown skin complexion rich in melanin, you should be careful about how much sun your skin gets. You can do CO2 laser treatments, chemical peels, and even more advanced options like photodynamic therapy with Levulin. But even with all of that, you still won't fully reverse all of the sun damage. So if you really want to have healthy, youthful looking skin, avoiding excessive sun exposure beyond what your skin can handle is non-negotiable. But there's something that most people forget or don't know. You also have to build what's beneath the skin. Muscle adds volume, structure, and support to your skin, and it plays a major role in how tight, firm, and youthful your body looks. From a vanity and aesthetic standpoint, muscle acts like an internal scaffold to the skin. When it's firm and developed, it can help reduce the appearance of sagging, and it can make the skin look tighter, firmer, healthier, more youthful because it's adding structure underneath. Also, resistance training specifically has been shown to improve dermal thickness. Regular resistance training also stimulates myokines, which are anti-inflammatory proteins that can indirectly benefit skin health. It can help reduce systemic inflammation, which is linked to aging. Some studies also suggest that resistance training may stimulate the production of collagen and elastin. A 2015 study found that people over 40 who exercise regularly had skin profiles similar to significantly younger individuals. Even on a cellular level, their dermis was thicker and more resilient. If you want to live a long, healthy life, you can't afford to not do resistance training because muscle health isn't just about making your body look more attractive, which building muscle definitely does. And muscle mass is not just a marker of fitness. It's not just about vanity. Muscle mass is one of the strongest predictors of how long and how well you'll live. Sarcopenia, the loss of muscle mass and strength, that happens to us with age, well, studies show that those individuals with sarcopenia face a 20 to 30% higher risk of all cause mortality. Sarcopenia, the age-related loss of muscle, doesn't just weaken your body, it throws off your entire metabolic system. Muscle is your body's main site for glucose disposal. It's where sugar gets burned. So when muscle mass declines, your body gets sluggish at handling carbs and storing energy efficiently. The less muscle you have, the harder it becomes to manage your weight, your energy, and your insulin sensitivity, even if you're eating clean. As you age, your muscles require stronger stimuli to stimulate growth. So your muscles need more of a push to grow, and hormones play a major role in that resistance. And partly why is because aging brings about a decrease in anabolic hormones, declining testosterone, growth hormone, and estrogen. But it's not just testosterone and growth hormone. Estrogen also plays a major role in muscle maintenance, especially for women. After menopause, when estradiol drops, we see a shift in the levels of IGF-1, a hormone that helps build and preserve muscle. That hormone starts to fall, and at the same time, myostatin, a protein that tells your body to stop building muscle, starts to rise. The result is that your body becomes more resistant to building or storing muscle, even if you're training and eating right. Estrogen also helps guide glucose into your muscle cells instead of storing it as fat, which makes it a kind of metabolic beauty hormone. So when estrogen drops, it's not just your cycle that changes, it's your entire muscle and fat balance. So this is a valid reason to look into hormone optimization for both men and women. But even if you build muscle to add structure and volume, it's not going to replace the need to care for the skin directly. That's why combining strength training with biostimulators and regenerative treatments come in. So what can Sculptra do? Unlike fillers that simply add volume, Sculptra is a biostimulator that stimulates new collagen to rebuild the skin's internal structure. This works to thicken the dermis, boosts elasticity, and restores that natural-looking firmness that's so hard to fake. And if you're worried about fibrosis, which we discussed in past videos, in this case, a little controlled fibrosis is exactly what can help tighten the skin.
So this patient's décolleté had very fine lines that can happen as we age, likely worsened by sun exposure. And these are results after one treatment and one single vial of Sculptra. And you can really see how this softened her lines and improved the skin quality and minimized those very, very fine lines. And her skin looks more youthful now. I looked at this before and after. It was unbelievable. We did one vial of Sculptra to her abs, but I also noticed how much more toned she looked. So I asked if she was doing anything differently, like more resistance training. And she said the only change was that she started taking creatine. Creatine can help enhance muscle tone by increasing strength and improving muscle cell hydration, which can give the muscles a fuller, more defined appearance. So between Sculptra working in the skin, the results were next level. Here's another before and after abs with one treatment. You can see this help reduce skin laxity and tighten her skin. Here are my abs, and I wasn't even sure if I had results when I looked in the mirror. And this is why you must look at before and after photos or video, because the process is so gradual that you may be skeptical. I wasn't sure I had results, but when I compare these two before and after videos, you can see the difference when I rub on the skin. Here's someone I treated for cellulite to her thighs and butt. We did 2 treatments utilizing 2 vials each treatment for a total of 4 vials. And you can see it did a really nice job of smoothing out some of the dimpling. This gave her way more confidence. So it's great for textural change and cellulite. The reason her butt looks smaller here is because she lost weight, which also probably helped a little bit with the cellulite along with the Sculptra. But since we're on the topic of the butt, I just want people to know that if you're trying to achieve a larger butt with Sculptra, it takes a considerable amount of vials, which becomes very expensive, and it can't compete with the amount of volume you can get from a BBL. Here's someone who had a very apparent laxity to her knees. I wasn't even sure if she would get a result. And a big part of the reason she has so much laxity to her knees is because she spent years of tanning her skin. Even though she still naturally has a moderately pigmented complexion, she still got a lot of sun damage to her skin, which broke down a lot of the collagen and elastin, which led to a lot of wrinkling and sagging. This is after 4 treatment sessions of 1 vial to each knee. And you can see this really helped smooth out a lot of the lines and improve the texture.
Everyone is not going to have these results. This is why it's so important to intervene with these types of treatments early enough when you haven't lost too much elasticity. So the earlier you treat, the better your results. And even if you have results, you also have to maintain your results and maybe do treatments every year or every 8 months or so. Results will likely take longer to show on the body versus the face because, as mentioned, repair is slower on the body. So it may be a full 4 months before you see results to the body versus the face. Hands and neck shouldn't be treated with Sculptra because of the risk of forming nodules, but those other areas can be treated with Renuva. Some people also use hyperdilute radius. You can also use this new regenerative injectable we spoke about in this video. I'm going to be trying this other brand new regenerative treatment named PDGF to my neck. So far, I'm in love with it, and I think this could be an even better option than Sculptra because of the instant results that don't completely go back to baseline. So if you want to learn why I'm obsessed with this new treatment, check this video out.